parts here. Do you want me still to remove?
Yeah, that's fine. Good to meet you. My name is Mr. Adrian. I'm a consultant knee surgeon,
Okay.
and I specialise in knee sports injuries.
Okay.
And I'll be seeing you today. Tell me, sir, how old are you now?
27.
27. What's your job?
I work for Dominus Pizza.
Okay. And what do you do?
All day standing around.
Standing around. Okay. What sport do you enjoy doing?
Football.
Football. And apart from your knee, do you have any other medical problems?
No.
No. When did you injure your knee?
About maybe 6 months ago.
6 months ago. And how do you do it?
Running. No one tackled me or anything like that. It's just I've done a sudden stop.
Yeah.
Tried to pass the ball this way, and this bone made a movement.
Okay. You felt the knee make a movement.
Yeah.
Did you carry on playing or did you just
No,
stop?
stop.
Did the knee swell up?
Yes, on
It
the
did.
first 2 days.
First 2 days, okay. And how has your knee changed between then and now? What's wrong with your knee now? Why is your knee now not normal? Why is it not normal? What's the problem?
I have problem bending down.
Okay.
Sometimes I don't feel stable.
Okay, you don't feel stable. Okay.
Sometimes, yeah.
How about when you're twisting and turning? Do you feel unstable when you're twisting and turning?
I think it's quite stable when
Quite
I'm
stable.
twisting, yeah.
Okay. Have you had any physio?
Yes, I
You've
did.
had some physio. Has that helped?
Yes, because until 3 months after the injury, I couldn't
Get you
stretch
stretched.
my leg, but
Okay.
now I can do.
Okay.
But
Have you been back to football?
No.
Why not?
Well, reason, since everything happened, I went to the first private doctor,
Mm-hmm.
and I've done an MRI with him.
Okay.
He said I had a torn ligament,
Okay.
and I even have, if you want to see the.
That's okay. I've seen them already. But is there anything in your knee that has stopped you playing football?
Sometimes, for example, running, I can't perform the full movement like big passes.
Is that because you lack confidence or?
It could be a bit difficult, to be honest.
Yeah, okay. Any clicking or catching in the knee?
Yeah, it's constantly clicking.
Clicking. Is that new or is it always clicking? Because knee normally clicks
Since
since the injury.
since the injury.
Okay. Pop your feet over here. Shuffle back for me and relax. Okay. Nice and relaxed. Loose and floppy. Make your legs loose. That's good. Relax for me. Just relax. That's it. Really relax for me. Really relax. Loose and floppy. Anything else? Bring your ankles together. Really relax for me. Loose and floppy. Really relax. Okay, put this down. Is that sore somewhere?
When you pull back into
Yeah,
the.
get there. Okay, and relax. Okay, alright. So, as a result of your injury, you've torn one of the ligaments inside your knee, called the ACL, and you probably have also torn one of the meniscus cartilages a little bit as well. But it's hard to tell because the MRI isn't very clear in that area.
Okay.
So the ACL does two important jobs. The first job it does is that it gives you a knee that you can be confident on and that is stable so that you can turn and twist and so that you can do turning and twisting sport like football. If you haven't got an ACL, you can sometimes still play football but sometimes not because you don't feel confident enough and your knee will buckle. And every time you buckle, you may injure something else inside the knee. The second job that the ACL does is that it protects the knee from arthritis in the future. So those are two jobs that it does. So right now you've got a choice, and the choice is that you can have some more physio and live with your knee as it is now, okay? Or Alternatively, you can have an operation. That operation is to rebuild the ACL. It's usually a day case operation. Usually you come in, have the operation, go home the same day. It's a keyhole operation. So we make a small scar here, take out your hamstring tendons, and use them to rebuild your ACL for you as a keyhole operation. We also assess the meniscus cartilages, and if the meniscus cartilages are damaged, we will treat them either by trimming them or by stitching them back. Okay? After the surgery, you have 9 months of rehab before you can get back to football. Okay? You're usually in a brace and on crutches after the operation.
For how long?
If you have no stitches on the inside, the brace is for 2 days, the crutches for 2 weeks. If we do stitching on the inside, then the brace and the crutches are for 6 weeks. It depends on what we do inside. We only know when we go inside. The risks of the surgery include the risks of blood clots, allergies, infections and scars, as well as numbness on the front of the knee. But all those risks are very small. There's always a risk that you could tear the new ligament, in the same way you tore your own one. That's about a 1% chance. And there's always a risk that you won't get back to football. So I can't guarantee you'll get back to football. The chances of getting you back to football are about 80 to 90%. Okay? But those are the choices. Either to have surgery or to not have surgery. And it's up to you.
What would have been your opinion about it?
Well, if it was my knee, I'd have the surgery. But the decision's up to you. Both options are reasonable. And it's up to you. And that's all the information, most of which I'm sure you were already aware of.
Yeah. So basically, see, if I do surgery, I'll be off work for what, 6 weeks?
Off work for 6 weeks. If you're doing a standing job, then you're probably off work for 4 to 6 weeks.
4 to 6 weeks.
Yeah.
Tough choice.
I think the surgery. Because he always...
So is it because the previous doctor said I didn't have the torn ligament? So that doesn't,
Okay. Well, that's their opinion. This is my opinion. Examining you, that ligament's gone.
Yeah, we'll go for the surgeon.
Yeah.
Yeah?
Yeah.
Okay. So I'm going to give you your notes. You take them to pre-assessment, and you'll see a nurse now who will do a fitness check on you, and we'll book you on the list, and we'll get you done. Okay? So take that with you. Pleasure meeting you.
Thank you very much.
And I wish you all the best.
Thank you.
See you soon.
See you. Não pode ver com esses joelhos seguros o tempo todo, entendeu? Se...
Eu ia falar com uma ligamento dando.
Melhor fazer cirurgia. Ele falou tudo que o primeiro médico falou, não foi? Relaxa, mano.
É 6 semanas, né? É um mês.
Não, não pense nisso. Eu tô perguntando pra você. Ele falou tudo que o primeiro médico falou, não falou?
Você precisa de chegou?
Posso continuar? É, amor.
Qual o primeiro? O privado?
É, obrigada.
Não, ele não falou isso.
Como ele falou? Ele falou do ligamento rompido.
Ele falou que eu precisava ver um cirurgião. Foi o que ele falou.
Tá, mas ele falou que o seu ligamento estava rompido. Já o outro...
É, sim.
Pois é, já o outro não falou.
Ele viu o mesmo exame. Você viu que nem pediu MRI? O mesmo exame. Pra mim tá rompido.
Pois é. Faz a cirurgia, amor.
Rápido demais, né?
Você vai pra mim continuar aqui?
Hum?
Continua aqui?
Desligou? Não, eu tenho que sair.